Hello, Dr. Samar. Hope you're having a nice time out in this wonderful quarantine. Okay, today we will be talking about a 32-year-old woman complaining of severe pain and swelling in her mouth that had been developed in the last 2 weeks. Here are the pictures. Okay. Regarding dental history, the patient visited the dentist complaining of a small lesion in the posterior area of the left mandible. However, she could not remember when did the lesion appear, but she said that mild pain and discomfort started a couple of days before she visited her dentist. Regarding the diagnosis, the first diagnosis was infection, so the treatment was extraction as well as antibiotics. After a few days, her left mandible had swollen again, and she developed mild to moderate dysphagia. She felt pain, and the swelling worsened dramatically, and she was referred to oral medicine department for further investigation. Regarding extraoral examination, it revealed asymmetry and swelling of the left side of the face. Intraoral examination as well, it showed a firm mass on the right side of the maxillary ridge, both buccal and palatal. It showed as well 4 to 5 centimeter in diameter. 4 to 5 centimeter in diameter, and also it showed a 4 to 5 centimeter firm mass on the mandibular ridge on the same side that had resulted in gingival erosion with pink bosselated surface. Regarding the lesion, it was associated with a bulky cervical mass on the right cervical region, starting from the submaxillary region up to the supraclavicular region. The rest of the body was normal. There was no fever, no night sweats, and she only mentioned a slight weight loss in the past 2 weeks because she didn't eat well due to dysphagia and pain. There are differential diagnoses that are mainly neoplasm. So squamous cell carcinoma and non-Hodgkin lymphoma. Here is a CT scan. It's an axial CT image with soft tissue algorithm revealing irregular resorption of the left maxilla. Here it is. Okay. Here's a better picture of it. Okay. Here's the histological examination as well. Incisional biopsy. Regarding the diagnosis, histological examination specimen biopsy showed that non-Hodgkin lymphoma diffused large B cell. Immunohistochemical and molecular features of the reported case confirmed the diagnosis of primary diffuse large B cell lymphoma of the oral cavity. Okay. There were no signs of the disease elsewhere in the body. Computed tomography and MRI scans of the chest, abdomen, and pelvis, as well as bone marrow biopsy, did not show any abnormalities. Lab tests, including renal and liver function tests, were within normal limits, and the patient was HIV negative. Okay. To discuss, lymphomas are malignant neoplasm of the lymphocyte cell lines. They are histologically characterized by the presence or absence of Reed-Sternberg cells. They mainly involve lymph nodes, spleen, and other hemopoietic tissues, with painless enlargement of lymph nodes being the most common presenting symptom. So the most common presenting symptom is painless enlargement of lymph nodes. Okay. Regarding head and neck, lymphomas are the most common neoplasm, second to squamous cell carcinoma, and make up to 5% of all malignancies of head and neck. Moreover, the head and neck is the second most common region for the extranodal lymphomas. Okay. Regarding the treatment, the patient was referred for chemotherapy. After 2 cycles of RCHOP regimen, the oral lesions regressed significantly and the patient became symptom-free. There's a take-home message that says that although rare, NHL can involve facial bones with only mild and non-characteristic symptoms. The diagnosis of oral lymphomas may be challenging because frequently there is a low index of clinical suspicion, leading to misdiagnosis or delayed treatment. Therefore, it is important that healthcare professionals be more alert about this malignancy and perform a thorough physical examination supported by proper radiological and histopathological investigations in order to identify the disease at an earlier stage. Okay, so what we understand is that the diagnosis of oral lymphomas is difficult and it is challenging and it is easy to misdiagnose or it is easy to delay the treatment. Therefore, the most important thing is that whether it is a doctor or any person regarding healthcare, they have to be alert. They have to do a very thorough physical examination and to supply it with radiographs, radiological and histopathological investigation in order to identify the disease and in order to um, design a full treatment plan that coincides with the patient's case. Thank you, Doctor.